Right now, at this very moment, millions of adults over 60 are taking their blood pressure medication, checking their numbers, seeing a reading that looks perfectly healthy, and unknowingly putting their brain, heart, and kidneys at risk. Not because they are doing anything wrong, and not because their doctor is careless, but because the blood pressure target they are chasing may have been designed for a body much younger than theirs. What if the number you've been told is ideal is actually too low for your aging arteries? What if the dizziness you feel when standing up, the morning brain fog, or the need to hold on to a railing for a few seconds isn't simply aging at all? Today I'm going to explain why some adults over 60 can develop serious problems when blood pressure is pushed too low, what researchers call the J-curve effect. Why a simple blood pressure test that takes less than 3 minutes could reveal a hidden problem, and the 3 questions every older adult should ask before their next medication review. I'm Dr. Jasika Parker, and this may be one of the most important conversations you'll ever have about your blood pressure. Most people believe lower blood pressure is always better, and for many younger adults that is true. But after age 60, the body begins to change. Arteries gradually become stiffer as collagen builds up and elasticity decreases. Instead of behaving like a flexible garden hose, they begin acting more like a rigid pipe. Because of this natural aging process, older arteries sometimes require slightly more pressure to move blood efficiently to the brain, heart, and kidneys. Yet many people continue chasing blood pressure targets that may not fully account for these age-related changes. This brings us to an important concept known as the J-curve effect. Researchers expected cardiovascular risk to continue falling as blood pressure decreased. Instead, studies involving older adults found that risk often decreased only to a certain point and then began rising again when blood pressure dropped too low. The graph formed the shape of a letter J. In other words, extremely high blood pressure is dangerous, but for some seniors, excessively low blood pressure may also create problems. I saw this in a patient I'll call Margaret. She was 71 years old, active, independent, and careful about her health. Her blood pressure averaged around 148/84, so an additional medication was prescribed to bring her closer to the recommended target. 6 weeks later, her readings had fallen to approximately 118/72. On paper, everything looked excellent. The numbers were lower, the chart looked better, and her treatment appeared successful. But Margaret didn't feel successful. She felt dizzy whenever she stood up. She experienced brain fog in the mornings. She nearly lost her balance several times and quietly stopped taking her daily walks because she no longer trusted her legs. Like many older adults, she assumed this was simply part of getting older. When we measured her blood pressure lying down and then again immediately after standing, her systolic pressure dropped by 24 points. She had orthostatic hypotension, a condition where blood pressure falls significantly when a person stands up. Every time she rose from a chair, her brain briefly received less blood flow than it needed. After carefully adjusting her treatment in coordination with her physician, the dizziness disappeared, the fog lifted, and she returned to her daily walks. Her blood pressure was no longer aggressively low, but it was appropriate for her individual body and symptoms. The reason this matters is because aging arteries work differently than younger arteries. Healthy arteries stretch with each heartbeat and recoil between beats, helping maintain steady blood flow. As arteries stiffen with age, that recoil weakens. The top number, known as systolic pressure, often rises because the arteries cannot absorb the force of each heartbeat as effectively. Meanwhile, the bottom number, known as diastolic pressure, often falls because there is less elastic recoil maintaining pressure between beats. This creates a wider gap between the two numbers, known as pulse pressure, which is one of the most common signs of vascular aging. For some older adults, aggressive treatment can lower the bottom number even further. That matters because the heart receives much of its own blood supply during the resting phase between heartbeats, and both the brain and kidneys depend on adequate pressure to function properly. Research suggests that excessively low diastolic pressure in certain older populations may be associated with increased cardiovascular risk, reduced organ perfusion, and cognitive decline. This does not mean blood pressure medications are harmful or unnecessary. It means that treatment should be individualized rather than based entirely on a universal target. That's why I want to ask you a simple question. Has your doctor ever measured your blood pressure while lying down and then again after standing up? For many adults over 60, the answer is no. Yet orthostatic hypotension affects a significant number of older adults and is strongly associated with an increased risk of falls. And falls remain one of the leading causes of serious injury and loss of independence among seniors. So what blood pressure should you actually aim for after age 60? The honest answer is that it depends on your overall health, symptoms, activity level, and medical history. For many healthy and active adults between 60 and 75, a target below 130/80 remains strongly supported by evidence and can significantly reduce the risk of stroke, heart attack, and cardiovascular disease. However, for adults over 75, or for those experiencing dizziness, balance problems, falls, frailty, or cognitive changes, blood pressure goals may need to be individualized. In some cases, a slightly higher target may be safer and more appropriate than aggressively pursuing lower numbers. Before your next appointment, write down these 3 questions. First, can you measure my blood pressure lying down and then standing to check for orthostatic hypotension? Second, based on my age, symptoms, and overall health, what blood pressure target is right for me personally? And third, could any of my current medications be contributing to dizziness, lightheadedness, balance issues, or mental fog? These 3 questions can help ensure that treatment decisions are based not only on numbers, but also on how your body is actually functioning. The most important thing to remember is that blood pressure management after 60 is about more than reaching a specific number on a monitor. It is about maintaining healthy blood flow to the brain, heart, and kidneys while preserving balance, cognition, independence, and quality of life. If you frequently feel dizzy when standing, experience unexplained mental fog, or notice changes in your balance, do not automatically assume it is simply aging. These symptoms deserve attention and a conversation with your physician. Never stop or adjust medications on your own, but do bring these concerns to your next appointment. Good medicine begins with informed questions, individualized care, and looking at the whole person rather than a single number on a chart. I'm Dr. Jasika Parker. Stay informed, stay empowered, and take exceptional care of your health.